Hi, my name is Raj Agarwal. I'm a GP and an aesthetic practitioner in Cardiff. Thank you for choosing to watch our video today. Today I'm going to use botulinum type A toxin for the treatment of upper facial wrinkles. So Nick has kindly volunteered to be our model today. Hi Nick, how are you?
Yeah, good, thanks.
Okay, so we can see from Nick, he has 1 or 2 lines, but if you frown for me Nick, he has those classic number 11 lines caused by the corrugator and the procerus muscles. And if you surprise for me Nick please, and he has quite a few deep lines and they're created by the frontalis muscle. If you turn over to me Nick, and if you give us a big smile, there we go. As you can see, there are several crow's feet lines there, and we'll be treating these areas today with BOTOX. So the first part of the procedure is to disinfect the area with an alcohol wipe to remove any bacteria and debris. We can then start injecting the toxin once the alcohol is evaporated. I'm now going to mark Nick's face where I want to inject my toxin. I'm going to inject the lower forehead muscles first, and inject the product. Excellent. And inject into the bulk of the procerus muscle. There we go, well done. And there we go. And then into the insertion superficially of the corrugator. Good. There we go. As you can see, a little bit of blood easily wiped away. I'm going to place 4 units of product here. As you can see, we get these nice little plebs where the product is lying just between the skin and the muscle. So that's the treatment of the forehead. As you can see, there are tiny blebs where the product is placed between the skin and the muscle, and over the next 20 minutes those blebs will gradually just dissipate and disappear. So we're now going to inject the orbicularis oculi muscle, which creates the crow's feet. So if you can give me a big smile, Nick, there we go. We can see Nick's wrinkles when he smiles. And if you can relax again for me. So we'll start at the bottom. Okay, here we go. Bit of a scratch. And placing the product just above the muscle so that it disperses into the muscle. And as you can see, we've got nice blebs of product in the desired area. So that's the procedure completed.
Thank you.
How was that, Nick?
Really good.
Excellent. Okay. So just some aftercare instructions. Don't rub the area, simply because our hands can be dirty sometimes and you don't want to cause any infection. No lying down and no bending over for 3 to 4 hours, and no sunbeds for about 2 weeks. We'll see you then in 2 weeks' time, and if there's any top-up needed, we can arrange that and we can see the final result.
Thank you very much.
Thanks very much.
Thank you.
Okay, so we're 2 weeks down now for Nikki's post-treatment review. And so Nikki had botulinum toxin A, or BOTOX treatment, to his forehead, frown lines and the crow's feet. Give me a frown, Nikki. There you go, and surprised. And turn to the side, and big smile. So we can see that it's diminished the frown lines, the forehead lines and his crow's feet, and given him a nicer, fresher, open look complexion. How was that, Nikki? Happy with the treatment?
Really good.
Okay, fantastic. Thank you very much for tuning in.